This is Dr. Shakil Ahmed. Today I will present a short video about ascites. First of all, the definition of ascites is the presence of free fluid in the peritoneal cavity or abdomen. The ascites is divided into transudate, exudate. The transudate may be due to portal hypertension, poor cardiac output, or fluid overload. Helpful clues for common diagnosis of transudate is to look for the cause. Cirrhotic liver may be one of the causes. Engorged hepatic veins in the heart failure, and chronic renal parenchymal disease may be a cause for transudate ascites. This is the transverse transabdominal ultrasound image, which shows large volume of diffuse anechoic ascites in a patient with a cirrhotic liver. Here is a segment of small bowel loops that is floating inside the ascitic fluid. The exudate ascites has many causes. The popular are carcinomatosis, peritonitis, inflammatory causes, post-traumatic intra-abdominal tumor rupture. In carcinomatosis, peritoneal deposits, omental cake, other evidence of metastatic or primary may be located. Inflammatory causes may be due to the pancreatitis, polycirrhosis, and hemoperitoneum. The peritonitis may be pyogenic peritonitis or may be tuberculous peritonitis. Pyogenic peritonitis is appeared as dilated fluid-filled bowel with peristalsis, marked echogenic peritoneal fluid, abscess, or other causes of sepsis. While in tuberculous peritonitis, there is diffuse omental thickening, nodules or mass, debris, septations may closely mimic carcinomatosis. Hemoperitoneum, there will be history of trauma with or without solid organ laceration, fracture, or aortic injury. Intra-abdominal tumor ruptures are usually large and present with acute abdominal pain. There are few rare causes of ascites. One of them is chylous ascites. Chylous ascites is when chyle collects in the abdomen. Chyle is a milky fluid made in the bowel or intestine during digestion. Chylous ascites develops when there is a disruption of the lymphatic system, which occurs due to traumatic injury or obstruction. It may be benign or malignant. The urine may be present due to rupture of the KUB. The bile may be present due to rupture of the GB, and CSF may be present due to the shunt. Key differential diagnosis issues. First of all, simple ascites is an anechoic fluid. In this is definitely transudate. But there is exception like dialysate fluid, CSF from ventriculoperitoneal shunt, and complicated ascites. This is echogenic fluid. It may contain debris. It contains septae. In this is called exudate. Or there may be hemorrhagic or chylous ascites. Whenever there is septae, it will suggest subacute or chronic nature of the ascitic fluid. This is transverse transabdominal ultrasound, shows multiloculated ascites with multiple thick septae in low-level internal debris in a cirrhotic patient with previous spontaneous bacterial peritonitis. These are the thick septations. Some internal echoes are present and there is loculation. This image shows anechoic ascites associated with multiple irregular hypoechoic soft tissue nodules representing metastatic deposits with malignant ascites. This image shows pseudomyxoma peritonei, which is seen as an irregular soft tissue mass with numerous internal cystic spaces. Pseudomyxoma peritonei is a very rare type of cancer. It usually begins in appendix as a small growth called a polyp. This is different to polyps that cause bowel cancer and is called a low-grade appendiceal mucinous neoplasm. This is longitudinal transabdominal ultrasound of the right lower quadrant, and it shows a small amount of ascites in this patient with a mobile tubular structure. This is representing roundworm infestation with peritonitis. Longitudinal ultrasound of the right lower quadrant shows markedly echogenic peritoneal fluid with no loculation or septation, and this suggests acute but complicated ascites. This may be pus or blood. This was peritonitis with frank pus with a ruptured acute appendicitis. This transabdominal ultrasound shows a small amount of ascites with peritoneal thickening. And this was a patient suffering from tuberculous peritonitis. This is complicated ascites fluid with low-level echoes. In this case, hemoperitoneum due to the ruptured hepatocellular carcinoma was appreciated. Thank you for watching, and if subscribed, it will definitely encourage us for making more videos. Thank you all.